put the slideshow on. Okay, so we're going to talk to you about our peer-led yoga group medical visit intervention for patients with chronic health conditions at Cambridge Health Alliance. We did 2 pilot groups, and Julia Naganuma Carreras and I, Richard Gawande, are going to talk about this work. Also intimately involved in the work were and are Dr. Paula Gardner, Kiona Aviles, and Jeffrey Thomas. So first, gratitude to our patients, to Dr. Paula, Mandela Yoga Project, to Sonia, to our peer facilitator, Kiona Aviles, our whole medical staff and medical assistant interpreter leadership, our health system, and the Center for Mindfulness and Compassion. Cambridge Health Alliance is where we did this work, and then our funders at Robert Wood Johnson. And especially ICGMV and our partners there. And I'm seeing Lourdes here, which is very exciting. Hi, Lourdes. And thank you all for coming. So some background, people of color, POC, are disproportionately affected by chronic health conditions. Our communities collectively are at a higher risk for and have lower rates of control of many chronic illnesses, including diabetes, hypertension, obesity, and heart disease. Systemic barriers, both in healthcare and community settings, impede access to culturally responsive care that addresses both the impacts of racial trauma and stress. The Mandela Yoga Project was founded to develop a peer-led yoga support program to support healing in racially traumatized nervous systems. And we piloted this intervention, Mandela Yoga Group Medical Visit, with patients with chronic illness at Cambridge Health Alliance Malden Care Center. So a brief introduction to Mandela Yoga Project. This is some of our team. Mandela Yoga was founded to be a public health crisis system solution for the people, by the people. And the mission is to scale the delivery of a new system of free, gentle, peer-led yoga designed for all bodies, to address stress, racial trauma, and chronic health conditions, and implemented in public health crisis communities by residents who are well-trained and well-compensated. One of our peer facilitators, mentors, seed teachers, Kalatoma, shared, "We are all related, from the 5 to 10% who survived, just like all the roots in the earth. We just connected like that. Even if we might not know our history or if we don't remember the why, but our bodies remember, our DNA knows. It's almost like an urgency of giving the hand that we were hoping to receive once that never came." And just to honor Kalatoma's words and all that have given, who are visible and invisible here, I just wanted to offer 3 breaths before we continue. So if you'd like, you can just sit comfortably. You can close your eyes or keep them open. And just inviting a breath in and out. In and out. Breathing in, breathing out. You are invited and encouraged to continue breathing throughout the rest of this presentation. So our group medical visit was co-designed with both the Mandela Yoga team, some of those folks that you saw earlier, and our healthcare and community partners. And I'm going to pass it over to you, Julia.
Sure. So yeah, we had a team designing the Mandela Yoga Group Medical Visit, which consisted of team members from the Mandela Yoga Project, as well as healthcare and community partners. So for this, we recruited adult participants with chronic conditions via flyer, physician visits, and epic messages. Physicians sent out messages to providers and patients. Mandela Yoga Project staff also attended primary care huddles to talk about the groups and inform the physicians about what the group medical visit was going to look like. so they could have an idea of what patients would be the best fit for the group. Mandela Yoga project staff made initial and regular check-in phone calls to patients. Feasibility, acceptability, and feedback were assessed through attendance, pre-post session, and weekly intake surveys. And we also had post-group focus groups on the last session of the pilot round. Consent was obtained for audio recording, focus groups, and sharing anonymized quotes and themes. So just briefly, to look at the organization of the group medical visit. So this was a 90-minute visit. In the first 10 minutes, patients arrived, filled out a check-in form, and got their blood pressure taken. Then the group medical visit started with a check-in. Patients were seated in a circle and had about 20 minutes to check in with the doctor and with the peer facilitator about how they were feeling, their symptoms in the past week. And then they went into the Mandela Yoga practice, which is a 45-minute practice. And for this group, it was chair yoga. So patients could practice this seated or and could choose to move as much as they wanted to, or they could do the practice visualizing. And this was led by the peer facilitator in the group. And at the end of the practice, there was further check-in time with the doctor if needed. We asked the patients about what food they liked and brought snacks. We had some patients also bring in some homemade baked goods, which is nice and yummy. This is what our flyer looked like. So this was handed out to patients and posted in the clinic as well. And then this diagram, which we passed out flyers to patients as well in the group medical visit so that they could take the flyer home. It had more on it than just this. This is the simplified version of the flyer that we gave to patients, but this was so that they could take this home and use it as a tool to practice even at home. And patients mentioned that being very helpful, and even just stopping, like Richa just led us through, and just the breathing was a technique and tool that they used at home outside of the visit.
So we piloted 2 5 to 6 week group medical visits in both fall 2024 and spring, let's just say spring 2025. We're in the fall right now. And we had a Portuguese medical interpreter present for the second cohort. So we had some Portuguese speakers from our community there. So in total for the 2 groups, we had 29 adults on average, 53 years old. 21 of the 29 spoke English as their primary language. Others spoke Portuguese and Spanish. And about half were considered people of color in terms of their kind of self or in their medical chart identified as Black, Asian, Hispanic, Indigenous, and or mixed race and or mixed ethnicity. And so patients presented primarily with chronic pain. A lot of Dr. Paula's patients in this setting have chronic pain or fibromyalgia. And then many, if not most of them, had numerous secondary diagnoses, including diabetes, hypertension, and other mental health and or substance use diagnoses. So this initial kind of round of pilots was aimed at just, like, does this work? Does it work to combine this peer-led system of yoga aimed at supporting the racially traumatized nervous systems of people of color in a medical setting? And so we found that 72% of patients attended 3 out of 5 for the first group or 3 out of 6 for the second group sessions. Insurance was billed for all visits, and all 15, I think it was, who did our post-class survey said they would recommend the group to a friend or family member. We also asked patients weekly just to kind of check box at the end of the sessions. Do any of these apply to you? And you can see for the first group, which had 10 patients, there was a number of benefits from the group immediately sort of discernible from the patients, including more focus, less stress, less anxiety. Later in the second group, we also added questions about loneliness and community connection.
Yes. So we also got collected qualitative data on the groups through 2 focus groups that were conducted each on the last session of the pilot to assess from patients themselves, acceptability, what worked, what didn't work, what were challenges or barriers, just general feedback on how to improve the Mandela Yoga group medical visit to best suit the needs of the people in the room. So we recorded those 2 focus group sessions and conducted the thematic analysis of the focus groups. And from that, we gathered 4 key themes regarding patient experience. So the first was group connection and community building. Number 2, the MYGMV intervention is inclusive, high quality, and accessible. MYGMV provides physical and mental health benefits. And then patients also talked about perceived barriers. So,
Sorry.
yeah, is that time?
Should really wrap up in a minute. Thank you a minute.
Okay. Well, I can go. So here we present sub-themes within each theme, and patient quotes that we gathered from the focus groups, talking about Paula. She cares about you individually. I'm coming away with the feeling of I can do this. Patients talked about how the MYGMV offered reimagined healthcare. So it has legitimized yoga. Okay. The session will end in 1 minute. So patients talked about how medical settings can be scary, doctors can be scary, invalidating, and how being in this space in the Mandela Yoga group medical visit has legitimized yoga as a form of therapy. It's nice to be in this room, in this space, and feel like, okay, healthcare isn't so scary. And Kiona,
Probably.
yeah, I don't know.
Maybe we can just share. I'm going to put the quotes on for like 10 seconds. People can see what patients have said, and then we'll say goodbye. These were some perceived barriers. And so our discussion, this was acceptable and feasible. Improvements include various feedback.
Love, love, love. We love celebrating our